Hello, and welcome back to Mammalian Anatomy at Keuka College. In this video, we're going to continue our lecture series on the respiratory system, and specifically, we're going to focus on the organs of the respiratory system. My goals for you for this lecture are to, 1, be able to identify the organs of the respiratory system on a diagram, 2, be able to trace the pathway of air starting at the nose and going to the alveoli, and be able to trace it going from organ to organ to organ. And lastly, I would like you to be able to know the function of each organ of the respiratory system. So let's get into it. So these are the organs that we're going to cover today. We're going to start at the nose and the nasal cavity, and we'll travel all the way down to the alveoli, where respiration is primarily going to occur. I'm going to give you a similar diagram to this on your exam and ask you to label it. Obviously, the labels won't be there. You will be doing the labeling, but we'll get into that. So let's start off and talk about the nose and the nasal cavity. So we're going to look at the nose and the nasal cavity, but before we go into the functions, I do want to look at this diagram and orient ourselves so that we know what we're looking at. So what we're doing here is we're taking a mid-sagittal cross-section of the head, and we are revealing the nasal cavity, the oral cavity, which is the mouth. So you can see here's the tongue, the teeth, the hard palate, and the soft palate. We also can see the back of the throat, which in anatomy we call the pharynx. We have the esophagus, which is going to travel down to the stomach. We have the larynx, which is our voice box, and the trachea, which will carry air down to our lungs. So now that we're oriented a bit, we can talk about the functions of the nose and the nasal cavity. So in our previous lecture, we did talk about how the nasal cavity is really important for olfaction. Olfaction meaning the sense of smell. And the olfactory epithelium is going to be in the superior region of the nasal cavity, and it's going to contain the olfactory sensory neurons that will bind to different chemicals that are dissolved in the mucus within the nose. And so we'll be able to detect those particular chemicals and interpret them as scent. But when we're talking about the respiratory system, its primary function is going to be the entrance of air. And so air is going to enter the nasal cavity through the nose, travel through the nasal cavity, and eventually go into the pharynx, the back of the throat. However, that is not the only passageway we can have air enter the respiratory system. It can also pass through the oral cavity. So it can go through the oral cavity, and it will also go into the pharynx. So the pharynx is shared by the respiratory tract and the digestive tract. So we'll talk about that more in just a moment. One of the major roles of the nose is going to be for immunity and also conditioning the air before it enters the respiratory tract. So how does it condition the air? So the air has to be warmed, moistened, and filtered before it goes into the rest of the respiratory tract. And one of the structures that helps us do that is going to be our nose hairs. The nose hairs are going to create a meshwork that are capable of collecting debris and pathogens, and therefore it also aids in immunity. And so it'll kind of help clean the air as it's entering the respiratory tract. We also are going to use these structures called nasal conchae. This may be a little bit familiar from when we talked about the nasal conchae in our section on the anatomy of the skeleton and its bone markings. And the nasal conchae are going to serve a really important role in conditioning and filtering the air. So what are they and how do they do this? The nasal conchae are going to be curved shell-like structures that are within the nose, and as air passes through, these nasal conchae will actually create turbulence and cause the air to spin as it's traveling through the nasal cavity. This spinning action and this turbulence slows down the air as it's going through the nasal cavity, giving the air more time to be warmed and moistened. And it is warmed and moistened by the blood vessels that are within the nasal cavity. The nasal cavity is rich with blood vessels. If anyone has had a nosebleed, you know this very well. And the blood vessels will moisten the air, and it will also warm up the air. In addition to doing that, the turbulence will and the spinning of the air will actually fling pathogens and debris out of the air and get it stuck into the mucus that is filling the nose and the rest of the respiratory tract. And so it'll help clean the air before it goes into the respiratory tract. So that's kind of cool. That has to be my favorite part of the respiratory system. I love the nasal conchae. I think they are the coolest thing ever. Yeah. So let's continue. All right. So in a nutshell, the nose and nasal cavity are going to condition the air by filtering it, warming it, and moistening it. It's going to aid in immunity, using those nose hairs and the nasal conchae to remove pathogens and debris, and it will help with the olfaction. Another thing that the nasal cavity and also the paranasal sinuses will do is that it will help modify our voice. As sound is traveling through these areas of our skull, they will vibrate with the resonant frequency of the sound, and it will help create our unique voice. Anyone who's had like a sinus infection or a stuffy nose may be aware of this, that your voice is going to sound a little bit different when you are sick, because it's not going to vibrate the same way as it normally would. So it's going to alter the sound of your voice. Moving on from the nasal cavity, we're going to go down to the pharynx. The pharynx is the back of the throat, and on this diagram we can see the different regions of the pharynx. So the pharynx is going to start behind the nasal conchae in an area called the internal nares, which is essentially meaning internal nostrils. And it will travel down to the beginning of the epiglottis. Not the epiglottis, the esophagus. And the esophagus is going to be the tube that carries food down into the stomach and is a continuation of the digestive tract. The pharynx is divided into three regions. The nasopharynx, right behind the nose, the oropharynx, behind the mouth or the oral cavity, and the laryngopharynx, which is behind the larynx. There's an interesting structure that is found within the nasopharynx. There's the opening over here to the pharyngotympanic membrane. We talked about the pharyngotympanic membrane when we were looking at the anatomy of the ear. This is a tube that connects the middle ear to the pharynx. And when we swallow, this tube will open up and allow the air pressure to equalize on either side of the tympanic membrane. So it's going to equalize on either side. So what is the function of the pharynx? Oops, this is supposed to say larynx rather than trachea. My apologies. Excuse me. So the pharynx is going to connect the nasal cavity to the larynx, allowing for the passage of air. And then also it's going to allow for the passage of food from the oral cavity to the esophagus. So the pharynx is shared between the respiratory system and the digestive system. This is why it's so important not to talk with your mouth full, because what will happen is if you are talking, your respiratory system will be open and food can get stuck in your larynx and in your trachea. So your mom was a very good anatomist when she says, no, 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 don't talk with your mouth full, because she knows very well that the digestive system and the respiratory system are connected using the pharynx. So, sorry, just being a bit silly. Okay. And the last thing that is going to be in the pharynx is that there are going to be the tonsils. The tonsils are going to be nodules that are going to be rich with white blood cells. And so these tonsils create a ring of immunity that the air and the food has to pass through before it enters the respiratory system or the digestive system. So that was the pharynx. Now let's go a little bit lower, talking about the larynx. So the larynx is going to be our voice box. And you can actually feel your larynx in your throat. It's right where your Adam's apple is. So if you put your hand on your throat and hum, you can actually feel your larynx, and you can feel the vibration of the vocal cords located there. So what are the functions of the larynx? First and foremost, there are going to be a strong series of cartilages that are going to surround the glottis. The glottis is the anatomical term for the airway that is passing through the trachea and the larynx. And so this cartilage is going to surround the glottis, and it's going to hold it open. The airway is very exposed in the throat over here because it's so anterior in the neck. So the cartilages make sure that the airway doesn't get crushed. So it's going to keep it open. So that's one function. A second function is that the larynx is going to contain the vocal folds or vocal cords. And these vocal cords are going to vibrate as air passes through and is going to be responsible for sound production. In a few slides, we'll talk about this in a little bit more detail, and there will be an essay on sound production on your test. And then the last structure that the last function that we're going to talk about is the epiglottis. And the epiglottis serves as an important gateway between the digestive tract and the respiratory tract. As we swallow food, we don't want that food to enter the larynx and enter the trachea because we don't want to choke. So what will happen is the epiglottis will actually fold over the glottis, fold over the airway, and direct food into the esophagus, which will carry the food into the stomach. So this is going to be a doorway that will open and close depending on what material has to pass through. So let's look at the structure and the cartilages of the larynx in a little bit more detail. So over here, what we're going to do is we're going to look at the cartilages. This large cartilage in the front is called the thyroid cartilage, and underneath the thyroid cartilage, kind of located over here, would be the thyroid gland, and they both get the same name because they are going to look like a shield. Thyroid means in Greek to resemble a shield, and I think that is a very apt name, and it can help you remember the function of the larynx because it's going to protect and shield the glottis and hold the airway open. Underneath the thyroid, we're going to have the cricoid cartilage here and here. Cricoid in Greek means it looks like a ring, and it's the only cartilage within the larynx that's going to go fully around the glottis. So it's the only one that goes all the way around. The other ones are going to only be on a particular side of the larynx. Over here, we can see the epiglottis, and the epiglottis is going to be a flap-like structure that it can actually fold down and close the airway and direct food into the digestive tract instead. If we go to the sagittal cross-section of the head again, we can see over here these blue cartilages on the diagram. This would be the thyroid cartilage. Here and here would be the cricoid cartilage. And here we have the epiglottis. As we swallow food, what will happen is the epiglottis will close over the larynx and it will direct the food into the esophagus. So we can make sure that the food is not going into the larynx or the trachea, and the airway is going to remain unobstructed. Two more cartilages. We have the corniculate cartilage and the arytenoid cartilage. The arytenoid cartilage is attached to the vocal cords or the vocal folds, and this arytenoid cartilage can actually be attached to muscles that will help stretch and relax the vocal cords, allowing us to change the pitch of our voice. So let's talk about sound production because that's one of the major functions of the larynx. The sound production is going to start by air passing through the larynx and passing through the glottis. And what will happen is as that air passes through, it'll cause the vocal folds to vibrate. And as they vibrate, they're going to create compression waves in the air. And these compression waves will be the sound waves that will be heard by our ears. And depending how the vocal cords vibrate, it'll create different pitches. We can control the pitch of our voice by contracting muscles that are attached to the arytenoid cartilage. And the arytenoid cartilage will actually stretch and relax the vocal cords. When the vocal cords are relaxed, it will have a lower pitch. When they're stretched, they will have a higher pitch. I kind of liken it to playing the guitar. If you haven't, if you strum the strings of a guitar, you'll see that the guitar string will vibrate, and as it's vibrating, it's actually going to vibrate the air in kind of the same-ish frequency, and that will create the sound wave that we pick up. If the guitar string is open and you're not like pushing down on the guitar string, it will vibrate in a certain way and it will have a lower sound. So when the guitar string is open, it will have a lower sound. But when you push on the guitar string, you're changing the length of the guitar string, and therefore it will vibrate in a different way. And it will have a higher sound, it'll have a higher pitch. So being able to control the length of the vocal cords will help you control the pitch. This is what singers do. They have very fine control of their muscles that are going to the arytenoid cartilage, and they can control the length of their vocal cords to create certain notes. I, for one, am very bad at this. I cannot sing if my life depended on it. My husband politely asks me to stop because it's that bad. So it is a thing that can be learned. Some people are naturally better at this than others, but I am definitely not one of them. So I will save you the torture of hearing me sing. Okay. So the vocal cords are going to vibrate, and if you stretch or relax the vocal cords, they can change the pitch. Males typically have longer vocal cords, and so this is why their voices are typically lower, while females typically have shorter vocal cords and creating a higher pitch. This is one example of sexual dimorphism that is found in humans. It's the pitch of the voice. Vocal cords don't work alone to create sound production. The sound will actually be modified by the positioning of the teeth, the tongue, and the lips, and it'll create particular sounds. I am a bit of a geek about this because I love learning languages and specifically studying like linguistics and why a certain sound is why a certain sound sounds the way it does, and how do you have to articulate the mouth to be able to create that sound. I kind of geek out about it a lot. So I hope you're geeking out with me, and I find it really fascinating and nerdy about it. Okay, so moving on. So this section would be an essay on your exam, so be sure that you can describe these steps of sound production. I know it doesn't go into all of the nitty-gritty details of sound production, but at least it's a good start. I will post a video where you can actually see a quartet singing. What the researchers did is they actually put a camera down into their larynx through their nose, and they are singing a song together, and you can actually see the vocal cords changing length and vibrating as they sing. It's a little gross, but it's also fascinating at the same time. So I'll post that as well. Going a little bit farther down into the respiratory system, we're going to look at the trachea. The trachea, in layman's terms, is called the windpipe, and it's going to be responsible for ventilation. It's going to carry air to and from the lungs. Specifically, it's going to carry air to and from the bronchi. So we'll talk about the bronchi in just a moment. The trachea is primarily composed of tracheal cartilages and ligaments connecting those cartilages. These cartilages do not form a full ring, rather they have a C shape to it. So if you see this histology slide, here we have the trachea and here we have the esophagus behind it, and the cartilage forms a C shape. Don't mind this area, it got just a little bit broken in the process of creating the slide, but in general they form this C shape. And the tips of the C are going to be connected by the trachealis muscle. It's important for this C shape to occur because the esophagus is located right behind the trachea, and the esophagus needs room to expand as food is traveling down through it. So, FYI. So that's the trachea, not too bad. The reason why we need cartilages within the trachea is because when we breathe out, we actually create a high pressure system within our thoracic cavity. And if these cartilages were not present, the airway would actually collapse, because the ligaments aren't strong enough to hold the trachea open. And so that would actually lead to obstruction, and the air would get actually stuck in our lungs. So the trachea or the tracheal cartilages hold the trachea open so that the air can pass through, even though there is a high pressure system within the thoracic cavity. We'll learn more about this high pressure, low pressure systems when we talk about ventilation in our next video. Now let's go into the bronchi. Bronchi, just for your benefit, is plural in Latin. The singular of this word is bronchus because it is a male word in Latin, so bronchus and bronchi is how we change up the word. Yay for Latin. And what the bronchi are going to do is they're going to connect the trachea to the bronchioles. And they're going to create a branching structure that is going to supply the different lungs, lobes of the lungs, and the segments of the lungs. And so it's going to bring air and ventilate those different regions. So there are going to be 3 bronchi that I want you to be familiar with: primary bronchi, secondary bronchi, and tertiary bronchi. And I would also like you to know what regions of the lungs that they supply. So the primary bronchi are actually going to be the first branches off of the trachea. And so here we have the left and right primary bronchi. And the purpose of the primary bronchi is to ventilate or to supply air to both of the lungs. So it's going to go one side or the other. Over here, we're going to have the secondary bronchi. Once the primary bronchi enters the lungs, the secondary bronchi are going to split and actually feed the different lobes of the lungs. The lungs are going to have different lobes. The left side is going to have 2 lobes, and the right side is going to have 3 lobes. And we're going to need secondary bronchi to supply each of those lobes. The lobes will be further divided into segments. So these tertiary bronchi will branch off of the secondary bronchi and supply each segment. So in a nutshell, we have the primary bronchi that are going to supply each lung, the secondary bronchi that are going to supply each lobe, and the tertiary bronchi that are going to supply each segment of a lobe. And so again, these are going to aid in ventilation. And notice as the bronchi get smaller and smaller and smaller, you'll see that they slowly start to lose that C-shaped cartilage, and rather there will be different plates of cartilages that will hold it open. And also, as we decrease the size and the diameter, the amount of smooth muscle will also increase. So primary, secondary, and tertiary bronchi. As the branching gets smaller and smaller, we form bronchioles. So if we're thinking of this as a tree, the trachea is the trunk, while the bronchi are the big branches, and the bronchioles are going to be the smaller twigs of the tree. The bronchioles are going to also be responsible for ventilation. It's going to bring air to and from the alveoli. But another function that they have is that they're going to be rich in smooth muscle. And so the bronchioles can actually regulate the amount of airflow through them. And so therefore they can regulate the amount of air entering and leaving the alveoli. So when the muscles contract, it'll cause bronchoconstriction. and reduce the airflow to that particular area of the lungs. When the smooth muscles relax, it'll cause bronchodilation, and that bronchodilation is going to allow for increased airflow to that area. This ability to regulate airflow is important when we're looking at sympathetic and parasympathetic stimulation. If we are, like say, running away from a tiger, if a dangerous situation, we're going to need more airflow going to our lungs because we're needing more oxygen to supply our muscles and our tissues in that dangerous situation. And we also need to get rid of that excess carbon dioxide that's going to be produced. So overall, we're going to need to increase airflow to our lungs when we have that sympathetic fight or flight stimulation. So the bronchodilation is going to help with that. When we're relaxed and chilling out, we're going to have that bronchoconstriction. We don't need as much airflow going to our alveoli and therefore going into our blood. And so the bronchioles are going to constrict. We need a good match between blood flow and airflow so that we can supply just the right amount of oxygen and get rid of the right amount of carbon dioxide, depending on our body's needs. Also, what is very cool is this bronchoconstriction and bronchodilation isn't going to be uniform across the lungs. Rather, areas that are going to have more effective respiration will have bronchodilation, and so we're going to redirect airflow to areas that are going to be respiring effectively. If there is an area that isn't going to respire effectively, we can do bronchoconstriction and limit the airflow to that area. So we can use our lungs as effectively as possible. So that's kind of cool. So lots of cool physiology behind the bronchioles. More into that in the future, but for now, just know that bronchioles carry air to and away from the alveoli, and they can aid in bronchoconstriction and bronchodilation. The smallest bronchioles over here, where we have the respiratory bronchioles, these are not going to have cartilage around them, and they are actually going to change the different type of tissue that is within them. They're going to have simple squamous epithelium, and this will start the respiration, start the gas exchange occurring. All right. A for bronchioles. Now we have the alveoli. So alveoli are going to be grape-like sacs that are going to be used for gas exchange, specifically for external respiration, when there is going to be an exchange of carbon dioxide and oxygen between the air and the blood, or between the alveoli and the blood. And so essentially, what is the structure of the alveoli? The alveoli are going to be composed of simple squamous epithelium. So it's going to be those very thin cells that are very effective at diffusion. That ability to do good diffusion is essential for allowing the carbon dioxide and oxygen to cross the cells. These alveoli are also going to be wrapped in a lot of elastic fibers. These elastic fibers, when we breathe in, will get stretched. But as we breathe out, what will happen is elastic fibers will do what they do best, is that they will recoil and snap back. And so these elastic fibers play a really important role in helping with passive expiration. They actually help us breathe out. We don't use, in quiet breathing and passive expiration, we don't use muscles to force the air out. The air will naturally come out as the diaphragm is going up into the thoracic cavity. and as these elastic fibers are recoiling and forcing the air out. More on that when we get into the next video. And you will also see there are lots of blood vessels, capillaries, surrounding the alveoli. This is going to bring the blood to the area, and we're going to allow for a gas exchange between the alveoli and the blood. So that's the alveoli. There are 3 different types of cells that are actually going to be in the alveoli. Type 1 pneumocytes, type 2 pneumocytes, and alveolar macrophages. Just remember for pneumocytes, it's like pneumonia. The P is silent because this is a Greek word. And so what we can see here is the type 1 pneumocytes are going to be actually the simple squamous epithelium that we talked about. These are the thin cells that are going to be responsible for respiration and the exchange of oxygen and CO2. The type 2 pneumocytes, on the other hand, are going to be located here. Type 2 pneumocytes are going to produce an oily secretion called surfactant. And surfactant is important because it will get in between water molecules. We didn't really talk too much about chemistry in this class, but water is a polar molecule, meaning that one side is partially positive and another side is partially negative. And so water molecules can actually attract each other. And this attraction at this microscopic level is a very, very strong force. And as the water molecules attract each other, it can actually limit how much the lungs can expand. And the attraction will actually help with passive expiration. The water molecules will attract each other and decrease the volume of the alveoli and push the air out. So at this level, that force is pretty strong. So we need to be able to expand our lungs more effectively and limit how much the lungs will collapse. We need to have an oily secretion that gets in between the water molecules. And so this is why we use the surfactant, or our body makes a surfactant. It's going to kind of break up the water molecules and make it easier for our lungs to expand. Premature babies actually don't have their lungs fully developed yet. And so this is one of the reasons why they have to be intubated and be given supplemental surfactant. Their lungs can't actually produce their own surfactant yet. And so this makes it difficult for them to breathe because they have to overcome that interaction between the polar water molecules. So premature babies have to stay in the hospital until their lungs can produce their own surfactant and they can breathe more comfortably as a result. The last type of cell is going to be the alveolar macrophages. Alveolar macrophages are going to be immune cells that are going to roam the respiratory system or roam the alveoli, and they're going to pick up pathogens and digest them and pick up cellular debris. Because we're talking about respiration, gases actually have to pass through the respiratory membrane, and the respiratory membrane has 3 layers. It's going to have the alveolar epithelium, the type 1 pneumocytes that are coated in that surfactant. It'll have the basement membrane over here, and then it'll have the capillary endothelium. This is going to be the epithelial cells that are forming the wall of the capillary. And both of these cells are very thin. They're going to be simple squamous epithelium. And so the gases can travel through and diffuse through fairly easily across this membrane. Just a little bit on the lungs. What we're going to do is we're going to go from the tiny microscopic and kind of zoom out into the gross anatomy of the lungs. Just some things that I want you to know about the lungs is the lungs are divided into lobes. The right lung has 3 lobes, the superior, middle, and inferior lobe, while the left lung only has 2 lobes. The left lung has to be a little bit smaller because it has to have the cardiac notch that will accommodate the heart. The lungs are encased in a membrane called the pleura, and just like the heart has 2 layers for its pericardium, the pleura will have 2 layers. There will be a visceral pleura that will come in direct contact with the lungs, and there will be the parietal pleura that will be farther apart. Farther away from the lungs. It'll come in contact with the chest, with the pericardium, those sorts of structures. And again, these 2 membranes are linked together, and there'll be a cavity between the visceral and parietal pleura. And this will form the interpleural space. And the pressure within that interpleural space is actually a negative pressure. It's a little bit of a vacuum. And this will physiologically link the lung and chest together. So as the chest expands, the lungs will expand with it. So more on that when we get into ventilation. So thank you so much for listening to this video. I know it's a little bit longer, but again, remember in this video, I want you to be able to know the function of each part of the lung, trace the pathway of the air from the nose to the alveoli, label those organs on a diagram, and there will be an essay section on sound production. Thank you and have a wonderful day and be good to yourselves. Bye-bye.